I didn't smoke, didn't drink, and did everything right. Got to the hospital and was dilated to 3 centimeters. I was thinking, oh, this is fairly easy. This is not too bad. Then I got stuck in the transitional part of labor, which is the hardest part of labor, at about 9 centimeters. And her doctor, Dr. Kerr, sat right by my bedside and immediately monitored Mandy's heart rate to make sure she was okay, and stayed there with me the whole time, and her heart rate was fine. I can still remember all this from 27 years ago. And then finally I wouldn't dilate, and he gave me some Pitocin, and I finally dilated and pushed Mandy down, and it was a normal vaginal delivery. But when she was born, there was a huge meconium stain, which at the time I had no idea what that meant, that meant the baby was in distress. The baby actually has a bowel movement inside of the mother if they're in distress. And she was somewhat blue. She wasn't crying at birth. So her father immediately said, "What's wrong, what's wrong?" And I heard this other doctor, who wasn't Mandy's pediatrician that I picked, but I heard her say out loud to some of the other nurses and doctors here, "Man, we've had a rash of bad babies born today." And I thought, what the hell does that mean? And of course, Mark and I, her father, were very upset, and they kind of whisked her away, and I didn't get to hold her on my chest like most moms do. And they put her in oxygen, and they had to use forceps to deliver her. And it was not a pleasant experience. It was really very traumatic. So after that, she was transferred from Mon General to Ruby Memorial, and she was in the PICU for 19 days on oxygen, off and on oxygen. She started having seizures, so they put her on phenobarbital immediately. I knew she was in the hospital and had to be in the hospital, but it was brutal to not be able to come home with your baby. And after 19 days, we went home. I pretty much thought I was bringing home a typically developing child because, like I say, there was only one doctor that kind of alluded to brain damage, and the rest of them said, we don't really know how she'll be. A lot of babies go through a difficult delivery. You know, she'll probably be okay, but we really don't know. And it's like nobody wanted to sit down and really talk to me about what they felt was going on with Mandy. And I didn't know that they'd done a CAT scan at Mon General, so it was really hard coming home without her. And I had wanted to nurse Mandy and kept trying to nurse her in between being with her at the hospital and coming home and trying to work and everything else. And ended up pumping at home when I got home and then bringing milk into her. But neither of us could relax in the hospital when we were trying to nurse because, you know, people would come in and pull back the curtain. "How you doing, Mrs. Westbrook?" And it was just really impossible to nurse in there. But when we took her home, we both relaxed, and I nursed her for 17 months. I'm really proud of that. She really loved nursing, and I did too. And then she went right from my breast to a cup, which I thought was really awesome. Wouldn't take a bottle, wanted nothing to do with the bottle. But when we left the hospital, a lot of people asked me, well, what did the doctors tell you about Mandy and how she was going to be? And the only thing I can remember is one doctor using the word brain damage, that there might be brain damage, but of course I didn't really want to hear that, so I just kind of didn't hear that. But most of the doctors said, we don't really know how she's going to be. She'll tell us how she's going to be as she grows and develops. There's really no way of knowing. I also didn't know that they had done a CAT scan when she was 1 day old. Nobody told me that until later. Took her home, started taking her to her regular pediatrician for checkups, and I immediately noticed she wasn't looking at me. She was cocking her head to the left, and I couldn't get her to come around and really look at me. But this was my first baby, so I wasn't really sure what that was. She cried all the time. She cried for like 9 months straight. And she lived in those swings that they have for babies that, you know, and that really calmed her. She really liked the swing. And then at 5 months, when we went back for her 5-month visit, I told the pediatrician, I said, I think there's something wrong with her vision. She's not looking at me. She's crying all the time. She's just looking to the left all the time. And he said, you need to see a neurologist. So he sent me to WVU to see a neurologist, and they did it. They told me they were doing a CAT scan at that point, and they did. And they did the CAT scan. We went back to see the pediatrician. And if you don't remember anything at all from this lecture today, I hope you'll remember this. So the pediatrician calls me into his office, her father and I, and he said, I want to go over the CAT scan with you. So over his quarter pounder with cheese and french fries, I still remember what he had. He was eating his lunch, and he pulled up the scan and put it on one of those, I forget what those are called. A viewer. And he said, this is Mandy's brain. This is the CAT scan that the neurologist did at WVU. And he said, see this big black hole right here? He said, that's basically Mandy's brain, or what's left of it. She's had what we call a hypoxic event at birth. She lost oxygen at birth. We're not sure why. And this is really all that's left of the brain tissue and the brain matter. And he pointed out a few areas that still had some brain matter, but that's how he told Mark and I, over a quarter pounder with cheese, that basically Mandy's brain was fried. And so we both just kind of sat there completely, what do you say to that? And the drive home was just incredibly awful. I remember going back to work, because I had gone back to work, or I think I had, and going in and talking to my dad, and my dad burst into tears, and I burst into tears. It was just awful. So I tell that story, and I've told that story for 25 years, because that is not the way you deliver that kind of news to a family. Just like if you're telling somebody they have cancer, you do not deliver it that way, because I will never forget it until the day I die. I took her back to him one time, and he once again said to me, you really should consider putting Mandy in some kind of a placement. You should consider an institutional placement, because she's never going to be able to really have any kind of a semblance of a life. And I looked at him and said, well, that might be your opinion, but it's not mine, and I'll never be bringing her back here, and I never did. You know, over the years, I've thought about why he delivered it that way, and I really think, I don't think he's a bad person. I don't think he's a bad human being. I don't think he ever got training on how to deliver that kind of information. And in the years that Mandy and I have been doing this, we've trained medical students with Maggie James, first-year medical students, and I always tell that story, because here are these people who are going to grow up and be doctors, and I want them to know this is how you deliver information, this is how you don't do it. And I asked them at the end of the lecture, do you get any kind of training on how to do this? And they look at me and say, you. So they don't get that kind of training. They don't know how to deliver that kind of information. They're smart people. They have a lot of book smarts. But to be able to sit down and give information, they just don't know how to do it. So I've kind of forgiven this pediatrician, because I really don't think he knew how to do it. Then I met Dr. John Bodensteiner, who is a wonderful man who came about, Mandy was probably a year and a half old, a pediatric neurologist, and I knew he was coming because her developmental pediatrician said, I think you should make an appointment with him and get his opinion on the scan, and maybe he'll do another CAT scan. So we went to see him, and he came in and showed me that there had been a CAT scan done at 1 day of age at Mon General, which nobody bothered to tell us, and then showed us the other scan that was done at Ruby. And he spent about 2.5 hours with us that day. I remember he walked in the room and his face was beet red. His face always used to get really red when he was mad or running late. And I thought, oh, who's this jerk? You know, great. And he walked in and sat down real quick, and but then I started to cry, and I think he identified with what I was going through, and so I could tell his whole demeanor changed, because he saw that I was very upset. We had waited like an hour to see him. And he came in and said, look, if I would have been here on day 1 of your daughter's birth, I could tell you exactly what happened to Mandy. And I said, good, somebody tell me. He said, you had a placental abruption. Your placenta tore, It happens to some women. We don't know why. We don't know why. Some women are predisposed to it, but some are. The placenta tears, blood and oxygen, don't get to the baby. And it could have happened when you were pushing her down the birth canal. It could have happened shortly before. We don't know. But that's what happened. And when I saw that first scan, I knew that's what happened to Mandy. And he said she has cerebral palsy because of that. That's what CP means. Lack of blood and oxygen to the brain around the time of birth. That's what cerebral palsy is. And I said, well, how will she be? Will she be able to walk? Will she be able to talk? And he said, well, I really don't know at this point. I can't tell you that she won't, but I can't tell you that she will. So his approach was completely different than the other doctors. And of course I cried through the whole thing. Mark was working, so he couldn't be there at that time. He said, I want you to try to digest this, take this in, and I want to see you back in 2 weeks. I want you to bring Mandy's dad. We'll go over the scans again. And I just looked at him like, wow, this is completely different than the quarter pounder with cheese episode I had. And so we went back in 2 weeks, and he did exactly what he said. He brought Mark in and went over the scan and said, this is some areas where she does have brain matter, and she might be able to do this, but she probably won't, but she might. So he gave me hope. He gave me a sense of hope about Mandy. And Mandy, I don't think anybody ever thought Mandy would live to be 27. And here I am, baby. Yeah, rooting for the Mountaineers. So that was kind of the beginning of our journey with Dr. Bodensteiner, and we started seeing him on a regular basis, and she started having seizures, and he told me that the medicine they put her on, he said, oh, I hate phenobarbital, let's try this, and he tried all of these different meds until we found the right one. Isabel Morrison was the social worker that came to my house and started early intervention with Mandy and I, and she got speech therapy, and she got PT, and she got OT, and then the social worker came to the house and talked to me about how was I doing, and well, I wasn't doing well at all. I mean, I had to quit my job because I couldn't work because I couldn't find any child care that I could afford for Mandy, because just a regular daycare wouldn't take Mandy. They said, you'll have to hire somebody special to take care of her, plus pay the $60 a week for daycare, and I couldn't afford that. So we went from a 2-income family to a 1-income family. I stayed home with her for 8 months, and it was really hard. And Isabel helped me figure out how I could get back to work, how I could get her on the Title 19 waiver program, which I'll talk about in a little bit, and just really helped me through all the emotional things I was going through. Is this my fault? What happened to Mandy? What did I do wrong? I was, of course, blaming myself for everything. School early on was good. She went from early intervention into preschool special needs, and she went to Mountain View Elementary, Jerome Park, South. I would go in every year and talk to the class and introduce Mandy to the kids and talk about her condition. And she was in a special ed room, but then they would take her to like art and health and different gyms so that she could have access to the typically developing kids. And it was good when she was little. As she got older, I'd say it started at really South. You know how when kids turn, what's the age of middle school? It's what? 12 and 13. The kids started to not pay much attention to her. They started to not call her to come over for parties, and things started to change. And that was hard. And then high school was a disaster at Morgantown High. It was a disaster because it was a room about the size of, maybe a little bigger than this room, and they had Mandy and every other child in there with all kinds of varying disabilities. Autism.
Is it still like that there? Is it still like that there?
I think so.
Really?
I'm not for sure, but I'm pretty sure it is. So we had a young man in there that was probably the size of Sham over here, who was profoundly mentally retarded but could walk, who had no concept of stepping on a child. We had him. We had kids with autism. We had a couple more kids like Mandy. It was just ridiculous. and they had an LPN in there who was the nurse, and Mandy at the time, I think she had just gotten her Foley or her G-tube, one of the two, and she would constantly call me. I can't get Mandy. I can't relieve her gas pain, or I can't get her Foley placed, or I would constantly get calls at work and have to run to the high school. And it was just, it got to the point where it was more stress on me, and she wasn't really getting anything out of it anyway. So kids can go to school till they're 21 with special needs, but her dad and I took her out at 18, and she had a teacher that came to the house and worked with her a little bit. But that was kind of a joke too. I mean, it just really wasn't that great. But she did graduate at MHS.
Yay!
She's got a, thank you very much. Thank you very much. Yeah. See, I graduated, you could have cared less, but you graduated. Yeah, but she was a part of that. So I guess early intervention was great. The early years of school were good. But even the early years of school,
Had some bumps.
had some
Talk about
bumps.
the speech path.
Yeah. This woman came to me one day. Well, she called me at work and said, "We have got to do something about Mandy's drooling." And I'm like, "What do you mean?" "Well, she's just like soaking everything. She's just drooling all over the place." And I'm thinking, you're a freaking speech pathologist. Don't go into that field if you don't like drool, you know? And so she wanted me to ask Dr. Bodensteiner if he could put her on a medication that would dry up the drool, because she'd done some research, and she thought that this would be the answer. And I said, well, I'll talk to him. I'm open to talking to him about it, but I'm sure it has side effects. Well, wouldn't you know, the side effects were constipation, drowsiness, everything that she didn't need. Back, and I told her, there's too many side effects to this to even consider trying it, so you'll have to deal with the drool. And I think it kind of pissed her off, but oh well, I mean, it was just unbelievable. Then we had a nurse. It was the county, I think it was the county school nurse, who saw Mandy one day. Mandy was probably 8, 9 years old. And Mandy looks very, she's put on quite a bit of weight. She's got meat on her legs. But when she was that age, she was very tiny. Her legs were like little sticks. And she called me at work and said, "Do you have any idea that your child looks emaciated?" And I'm like, "Excuse me? She's pale. Is she seeing a doctor?" "Yes." So I was so upset. I thought she was going to turn me into CPS, which happens to special needs parents a lot.
Well, she said, "I don't think you're feeding her."
Yes.
Yeah.
Good memory. She did say that.
Uh-huh.
"Are you feeding her?" "Yes." So it was so upsetting. So I went and got Dr. Johnson, who was Mandy's developmental pediatrician, who was following her like every 6 months. And he said, "Let me call and talk to her." So he did. And he said, "Do you understand? Do you know anything about cerebral palsy? Mandy is microcephalic, which means small head size, small brain. She's not going to be big. Carrie is a wonderful mother. She and Mandy's father take exceptional care of her. I'm her doctor. Please don't make that kind of assumption about a parent before you know anything about the child." And that was really hurtful. And I've had several friends who have kids with autism who have been turned into CPS because their kids have bruises on their body, or their kids may
In
have
dangerous situations, they often leave the house.
Right. They run away, they have no sense of danger, and parents have been turned into CPS many times. I started getting speech and physical therapy and occupational therapy, and of course the social worker came and helped me transition, and told me about the Title 19 waiver program, which is the waiver that is meant for people with pretty significant disabilities that would have ended up going into like an institutional placement, but parents want to keep them in the home. So you need the supports to make that happen. And that's why Carissa is sitting right here. She's an RN She works with Mandy while I'm at work and takes care of her, and it's paid for through the waiver program. And I could never afford to pay an RN to come and take care of my daughter with what I make. You know, social workers, counselors, we don't make big money, as you guys have probably figured out, or will figure out, unfortunately. But it's great work. It's really awesome work. But the waiver program gives you a lifetime medical card, regardless of income. So you can make $100,000 a year and still have a medical card. Gives you access to nursing services. She has a physical therapist that comes twice a week. That's paid for through waiver. I get a certain amount of money each month through waiver to help with the house payment, to help with anything that, you know, Mandy really needs. Mandy ate and drank really well till she was probably 12, 15 years old. But we were having such an issue with moving her bowels, with constipation, that one of the surgeons at the time said, I think Mandy needs a G-tube. And I got real defensive. No, she doesn't. She can eat, she can drink, she gets plenty of calories. Her doctor said she's healthy. You know, I don't agree with that. And she said, well, it would be easier to give her medicine. She could get extra water. I think it would help her bowels. I think you should consider it. And finally, Mark and I talked, and things were getting pretty bad, more frequent hospitalizations because of her bowel issues. So we had the G-tube done, and best thing I ever did for my daughter. Best thing. I mean, it just changed everything. Helped her bowels, helped giving her medication. And the thing that the surgeon kept saying was, just because you have a G-tube doesn't mean you can't eat. And I hadn't thought about it that way. You can still eat, you just have supplemental stuff going in through the G-tube. And I would puree the food up and put it through the G-tube, and that helped her too. So, excuse me. That was just an eye-opener for me that I need to listen to the doctors too, because, you know, she had a really good suggestion and it worked. It worked well, and I still got my G-tube. Yeah. Made everything easier, didn't it? Hospice supported our family. Instead of calling the ambulance when the neurostorms would start, we'd call the hospice nurses, and they would come out. And they would call the doctor, Dr. Dower, and he would say, well, let's try this. So they were really a big point of support for us. They supplied us with all the supplies while she was on hospice, her briefs, her underpads, her Foleys. And the reason Mandy has a Foley in, I don't know if you guys know what this is or have seen this, but Mandy has chronic UTIs. And so,
Say what a UTI is.
Urinary tract infection, I'm sorry. A urinary tract infection, which often people like Mandy get frequently. And we went through years of constant infection, constant antibiotics, and we decided to try, with the recommendation from her urologist, let's just try keeping it in and changing it every 10 days and seeing if the constant flow of urine keeps the bacteria out of her bladder. Because what happens is, a lot of people like Mandy who have the spastic CP, the real tight, rigid CP, you know how when you have to go to the bathroom, you just kind of, your muscles let it go? Well, she can't do that, or she does it and she doesn't empty the way she should. And if you don't empty your bladder, then the little bit of urine that remains in the bladder grows bacteria. That's a little lesson about UTIs for you. And they're very painful. They make you tired. They make you cranky. They're very uncomfortable. So since we started doing that, we still have UTIs, but they're not as hard to fix. They're easier to treat. So that's why she has this in, not because she can't urinate on her own, but because she doesn't empty her bladder. See, Mommy knows me really well. When I open my mouth like that, it usually means I need to belch. This is a Foley catheter. That's her G-tube. And you just open it up, and she basically farts out of the G-tube. Yeah.
It's go is in your small small intestine.
Small intestine, yeah. So she can belch out of that, but there's no air coming out, so I guess I'm okay. Here you go, babe. When she was in school, I used to go in and talk to the class about what she had, and I didn't want the kids to be freaked out when they saw this, so I would use that story. I would say, you know, what's really cool about this, guys, is Mandy can fart out of her G-tube. And the class would just crack up. And it was like after I told them that, they were so cool with it. They were like, oh, that's really cool. And they were fine. It's the adults that often were like, oh my God. But the kids always were so cool to Mandy. They never, once I explained it to them, they were okay with it. But, they were curious, like, what is that? So I've gotten off topic again. Back to the bowel obstruction. So we're in the hospital. She already had her G-tube, and her niece came in and had just had gallbladder surgery. And I said, what kind of symptoms did you have, Becky? And she said, well, I would eat, I would get like 3/4 of the way through my meal, and then I would have this intense pain. And I said, that sounds exactly what's happening with Mandy, because Mandy was eating at the time. I would puree her food, and she was a great eater, but she'd get about halfway, 3/4 of the way, and then scream. And her pediatrician, Chet Johnson, developmental pediatrician, said, oh, it's just gas. She's got a buildup of gas. Well, I knew in my heart it had to be more than that, but nobody could ever tell me what it was. So when Becky came in and described her gallbladder attack, I said to Rick Vaughn, her surgeon, could she have a gallbladder issue? Could she have gallstones? And he goes, nah, he said, she's not the 3 Fs. She's one of the 3 Fs. She's female, but she's not fat, she's not 40. And that's typically what doctors think of, you're heavy and you're at least in your 40s. I said, well, what would you have to do to tell me for sure that it's not that? He goes, well, I could do an ultrasound. I said, would you please, just please? And he listened to me, and he goes, sure, I'll do it. So he did it, and my mom and I went down with her. I'll never forget it. That technician goes, oh my God, and you could see 12 gallstones rolling around in this child's gallbladder. 12. Not 1, but 12. How she put up with that pain, I don't know. Because what would happen is they would roll back and forth, and they would get in that duct, that bile duct, and when they got in that duct, the pain was horrible. When they weren't in the duct, it wasn't that bad. But Dr. Vaughn was blown away. He could not believe it. And then I thought, if I hadn't pushed him, and if I hadn't had a doctor who would listen to me, she'd still have him. Because the other doctor refused to look at anything else. So he went in, took her gallbladder out, brought out a jar about this big, and there were 12 gallstones. And she was a different kid after that. And that's an important story because, a lot of times parents, when they're in a hospital, especially with surgeons all often have this kind of godlike attitude. And Rick Vaughn is one of the nicest, most personable surgeons you'll ever meet. But if I would have gotten some of the other surgeons that we have at Ruby, they would have just been like, oh no, that she couldn't possibly have gallstones. But he didn't take that approach. He really listened to me as a parent. And as Jenny and Diane, I'm sure, have told you a lot about family-centered care, that's the premise of family-centered care. The parent knows the child better than anybody. And still to this day, when I take her into the clinic, the doctors up there know her very well, and they know me, and they say, well, what's going on with Mandy? What do you think's going on? And I'm almost always right. Sometimes I'm not, and I still want their opinion, because I'm not a doctor, but I know Mandy better than anybody. So hospice brought all those supplies out. And then after being on hospice about a year, the nurse a couple weeks ago said, I don't think that we're going to be able to keep her on hospice because she's not declining anymore. She's kind of plateaued. So we're going to stop hospice. So your first reaction as a parent is, awesome, she's coming off hospice. And then my second reaction was like, oh, she's coming off hospice. I mean, I'm going to lose that support. So it was a good thing and kind of a bad thing at the same time, but I've talked to Dr. Dower, and he's like, don't worry, I'll continue to prescribe the morphine. When you get low, you call the hospice nurse and we'll get it for you. Because that was my biggest thing, is who's going to give me the morphine, because the neurologists don't prescribe morphine. Morphine is considered end-of-life medicine. So we've got that all worked out, but it was kind of scary to think that we were going to lose that support. Sad and think, my daughter will never do that. My daughter will never know what it's like to go out with a boy, to go pick out her prom dress. Those are things that Mandy will never have to deal with. On the other hand, then I hear them talking about things that their kids do, and I think, oh, Mandy won't have to do, I won't have to worry about Mandy doing drugs, I won't have to worry about Mandy going out and getting drunk like I did occasionally. You know, the things that we do as we're growing up that aren't always smart choices, Mandy, I don't have to worry about that. But there are still times I'll be maybe walking in the mall and I'll see a young lady that looks like Mandy. And I'll start to cry because I'll think that could be what Mandy could have been.
Mandy doesn't care. Mandy doesn't care. She's just more to that.
Mandy has been so lucky to have so many great things in her life. Her father is exceptional. I can't say enough about him. We're divorced, but he has been in her life from day one. And he takes her every other weekend, takes her for like 3 weeks in the summer. He is an outstanding dad. He puts her Foley in, changes her G-tube. He is outstanding. I'm so proud of him and the man that he is. He's a great daddy. And I haven't really talked about relationships, which sometimes I do, but it's been hard to find somebody who understands how much time I have to spend with Mandy. And I'm on my 3rd marriage, and it's been a hard, rough road, but I finally found somebody who, he was a single dad with 3 kids when I met him, so I knew that he was different because he has custody of his kids, and I thought, well, this must be a really special guy. And so now Mandy has 3 siblings. She has an 18-year-old, JP. She has a 15-year-old sister, Ashley, and an 11-year-old going on 35-year-old, Tristan, who, interestingly enough, is on the other end of the spectrum. He's gifted. So I've gotten to kind of see what that's like. JP, who is 18, adores Mandy, lifts her all the time, even lifts her when Carissa's there to help Carissa. He's amazing. Ashley is an amazing sister, and Tristan, they're all just great kids. And I think it's been good for them to get to know Mandy and to understand her disability, and she just adores them. We're all about Duck Dynasty at our house now. You know, I don't know if any of you like Duck Dynasty, but we watch that, and she laughs, and the kids love it, and she loves it. And we take her whenever we can take her, and she's well. We put her on the back of my husband's truck and bungee her chair in, and we take her, you know, wherever we can take her. When she loves to go out and go to the mall, go to movies. She's gone on boats with us. She's gone fishing. When she's well, Matt says, we're taking Mandy. We're taking her with us. So he's a really good guy. It's been hard. It's been challenging. It's been rewarding at the same time. But it's been a struggle. And these past couple of years have been extremely hard because Mandy started having what is called neurostorms. The medical term is autonomic dysreflexia. What it basically means is her body goes into kind of panic mode. You know, the flight or fight concept. You know how you feel when, say, you've just been in a car accident and you just get, you know, you kind of get into a panic, and these panics don't stop for her when this happens to her. And when it happened 2 years ago, we rushed her by ambulance to the ED because her heart rate was 200 beats a minute. She had broke out in profuse sweating, rash all over her. Her eyes got, Maggie James, her neurologist, calls it the deer in headlight look. Her eyes kind of get like this. It's kind of like somebody on cocaine that just can't come down. It's really horrible. Took her to the ED here at Ruby. They had no idea what it was. They thought she was having a heart attack. Oh my God, she's tachycardic. Does she have a cardiac condition? No. Okay, I think she's seizing. No, this isn't a seizure. This isn't what her seizures look like. But they did an EEG. They hooked her up to a video EEG. It wasn't a seizure, just like her dad and I told him it wasn't, but nobody knew what it was. So after a week in the PICU and talking to the neonatologist there, they finally figured out that it was some kind of they called them neurostorms. Some doctors still disagree with me. They still don't think that's what it is, but I know that's what it is because I've done a lot of research on it. And when you pull up neurostorms, everything she does, it fits to a T. So then I started looking at, well, what do you do? How do you fix these? Well, you don't fix them. And I learned from Dr. Dower, who is our hospice doctor, that these kind of events usually happen in end of life, during end of life. So he put her on hospice for a year because he said that he thinks in other people like Mandy who have CP and brain damage, this is in later years what he sometimes sees, are these neurostorms. So that brought us into a whole new realm of thinking about end of life and hospice and everything. And that has been really hard. But we found out that morphine does stop them. So Mandy is on a very tiny dose of morphine twice a day now. I mean, Mandy has been, I wouldn't trade Mandy for 10 normal kids in the world. What I would trade is all the medical problems that she has had because of her CP, which I'll get into. She's had a host of things happen to her that a lot of kids with CP never have to experience, and that's what I would trade. But I would never trade Mandy for anything.
Yay, Mandy!
She does know. Look at her eyes. That was for you. Yay! That was for you, sweetie. Her